and welcome back to Mother Tongue, your eyes, ears and finger on the pulse for all parents around the world. Let's get going, shall we?
We are so incredibly excited to welcome Lauren Whalan to Mother Tongue. Lauren, how are you?
I'm good. So glad to be here. Thank you for having me.
I'm so excited. I'm so glad that I finally got to pin you down. Because as we were just saying, I swear you and Dr. Delphine are probably two of the most popular people in my circles in Dubai. She is another lady that is a very long waiting list.
That's true. She is a brilliant practitioner and a lactation consultant, and she studied craniosacral therapy with me. Or the year after me, yeah. So she just finished her degree. So she's, but I don't know if she's practicing yet. I do hope she does because we need more.
Yeah, we do. We definitely do. Anyway, Lauren, for everybody who doesn't know you, can you tell our lovely listeners a little bit about yourself?
So I'm Lauren, originally from Sydney, Australia. So I grew up in a real sleepy town, actually, on 5 acres, one of 3 children. You know, a really simple life. I had a horse that we used to ride bareback. I had a goat, a billy goat, we called him. We had numerous dogs throughout the years. I mean, they were like my best friends. It was really an easy life. We had nothing in the town. We had local shops. We had the school, and that was it. So, I grew up in a really kind of humble house, really grounded. I was very sporty, and basically that's where it from there I kind of went into university, and I was lucky then to meet my husband at the age of 17. We're still together now.
Wow.
Yeah. So we then decided to, he finished the same year I finished uni, and then we decided to get married in 2007. And then we thought, let's get out in the world. So we were headed to the UK in 2008, headed for 2009. But then sadly the economic crash happened, and so that all went up in smoke. And then my husband got offered a secondment in Dubai, and that's really what brought us here. And I was lucky enough to get a job 2 days before I left. And then, that was in 2009, and here we are 16 years later, still here. Wow. And since then I've had 3 beautiful kids, Archie, who's 13, Spencer, who's 10, and Dawson, who's 8, and we live a really simple life. Again, I mean, it is easy to get caught up in, the glitz and glam of Dubai, but, we're homebodies. We love the beach. We love to have barbecue with friends, and, I work, and I work hard and I play hard. We love to travel to Europe. I mean, being from Australia, Europe's at our doorstep, so lots of travel. We're a new ski family, so we love to ski now. I've been doing that for 4 years.
Wow.
So work and play is really kind of what my life's about, but really enjoying it. And Dubai's got so much to offer. We're lucky to live here, and I'm really grateful to meet people like yourself and work with some amazing therapists in Dubai. So yeah.
Yeah, it is. I mean, I've been here for nearly 12 years now, and I feel so lucky that I get to live this life and bring up my children in this environment. And very, very blessed. It's a fab place to be. But I want to know what led you down the osteopathy route. And I mean, you have become known for treating babies and children. And I feel like obviously you are an osteopath, but you do so much more than that now, especially in the kind of children and baby space. What really led you down this path, and what drew you to children and babies in particular?
Well, as a kid, I always wanted to work with people. I had this calling that I wanted to help others, and I used to love actually giving massages to all my family. My dad's sisters used to say to me, "Oh, you've got magic hands. You have to get in to do something with your hands." And I was sporty, and I thought physiotherapy was where I was going to head. But as school kind of came towards an end, and I had to think about what I wanted to do, I was really drawn into alternative medicine. And then I came across osteopathy, and I was lucky enough that our local university had the only course in New South Wales at the time. And so I went and observed an osteopath and really fell in love with the diversity that it offered. I mean, you can go down so many paths. I mean, you train in classical osteopathy, but then as your skills develop, you can move into paediatrics, you can move into cranial, you can move into visceral, which is working with the organs. And you can bring in so many more complementary therapies to mix with that. And yeah, it was just really appealing for me. And so then I managed to be able to study while living at home because it was so close. And then I worked under this brilliant osteopath in Sydney who was really diverse. She treated everybody, but she really had a soft place for treating children. So observing her really inspired me. And she was also a cranial osteopath and a craniosacral therapist. So I really got to see everything. As a new grad, I mean, this is amazing to have such exposure, because you kind of just get thrown into the industry and you kind of got to find your feet and decide where is it you want to be. And some do stay just doing classical osteopathy, but I was really drawn to treating kids, so I went and started studying more pediatric specialized courses. I did some cranial osteopathy courses, and then when we moved to Sydney, so that was 3 years that I was working in Sydney, and then 4 years, and then we moved to Dubai. And I mean, you know what Dubai's like. It's baby booming. I mean, there's babies everywhere. So it kind of just started to organically happen that, you know, there was only about 12 osteopaths here at the time, and babies started to come to me, and then it just kind of rolled on from there. And next thing, it's like Baby Central, and I'm treating lots of babies, but everybody still, but really, yeah, working with some great people like Dr. Delphine, as we mentioned, other pediatricians, lactation consultants, even doctors, psychologists, midwives, I mean, the works. And now there's a really nice network where we can call upon each other and work as a team to really help these children, help these babies and their families just find the best for these kids so they can, you know, start life on the best foot.
Yeah, and I mean, I especially this time around with this particular baby, I think it has been the only thing that has helped his reflux. But I'll come back to that in a bit, because I wanted to ask, because I had no idea the difference between these two things. I thought they were exactly the same things, which just shows how much of a moron I can be. What is the difference between cranial osteopathy and then cranial sacral therapy? And how does it help babies and children in particular?
So, I mean, look, there's not a lot of difference. Cranial osteopathy was governed by a guy called Sutherland. So he was an osteopath, and he believed, like, he had a very refined touch, and he could listen with the most subtle of palpation skills and tune into the fluid dynamics of the body. So he worked mostly with the cranium and was listening to how the cranial rhythm moves, what we call the primary respiratory motion. And these subtle motions have a huge influence on the nervous system and what we call the cerebrospinal fluid, which is the fluid that embalms the brain and spinal cord. And this really kind of amplifies health in the system. So when we're tuning into that, we can read where there may be some restriction in the system, and we can use gentle touch and light pressure to restore harmony and balance into these bones, into the sacrum, into the spine itself, to restore that balance and optimize health. So cranial osteopathy kind of uses a bit more, like there's a little bit of application of some light pressure, where craniosacral therapy, again, is still part of osteopathy, but it's a different subset. So we've got a few different practitioners who have kind of gone off on their own and renamed it and changed it up a little bit. So we've got what we call biodynamic craniosacral therapy, which is where I studied, is SIL. We've got another guy, Jim Jellis, who does a different form. He's from the US. There's Upledger School as well. So they're all part of the same thing, but they're kind of slightly varied. So in craniosacral, what we're doing is actually listening more to the fluid tide. So that movement of the fluid that runs up and down the spinal cord, we're attuning to that, and where we can still feel all the mechanics that are changing, but we're actually working on holding space so that the nervous system can resonate, and we hold this sense of safety. And as the nervous system senses our touch, we start to regulate the nervous system, and then the body moves towards health, because we move more into a safe space, what we call vagal tone, a place where we can rest and digest well, and we can start to let go and surrender to trauma. Especially, we talk about birth trauma and these incidences where we're helping babies to be able to set things free, birth tension and all these other aspects that they can acquire, whether in utero or during the birth process or even after, during growth and development. So they're the two difference, and how they help babies is the fact that they're both really subtle approaches. They're not rough, they're not aggressive, they're using very light touch to really tune into the baby's body, to the fluids, to the organs, and really with a really nurturing, caring touch be able to identify where there are some stresses and strains in the body, and then allow the body to unwind itself. And it's amazing to watch. You can see literally babies just unravel on the table. Some of them who didn't get a vaginal delivery can sometimes almost rebirth on the table because they were longing for it and didn't get it. Yeah, it's a beautiful thing to see.
Wow. Oh God, it's so interesting. And as I said, I feel like with each baby, I've learned more about it as time goes on. But I find it so fascinating. And I remember the first time I took my eldest, he's nearly 5, to see Gilliam, and I remember he had tummy issues, and he just gave him the lightest touch down his back, and you could just see his face relax, and he did the biggest poo I've ever seen. And I remember thinking, you are magic. I've been waiting for this for 10 days. Like, how? It was just unbelievable. And I mean, I know that so many people have seen so much relief in coming to see an osteopath, but what are the most common reasons people come through your doors? What symptoms and issues do you see mostly?
Well, in terms of pediatrics, we're looking at, obviously we help mum as well. So during the pregnancy, maybe, mum's had a lot of stress or the baby's not in the right position. So we can help mum to feel her best, to relax her body so that we can try and optimize the baby's position, and really kind of, obviously depending on where they've chosen in terms of their birth story, where they're going to, are they going to go down an elective C-section, that's fine. But in terms of if they want to have a natural delivery, we can really help to open up the pelvis and get things ready for the baby. And then obviously we look at the baby in terms of, obviously it's position in womb, the way it was placed. We look at the birth itself, so whether intervention was needed, so whether forceps were needed or a kiwi. So these can obviously leave imprints into the baby and cause some stress and strain. So we can work with those things. Obviously, being a fast labour can cause some undue stress on the infant. A slow labour can have more compounding pressure on the cranium, which can also have long-lasting effects. Obviously, if there was distress, maybe baby kind of had some meconium, so maybe there was low amniotic fluid, or anything that can disturb the natural harmony of an optimal delivery, we can help in that instance. We can also look then, once they're born, we have a look at things like torticollis. We have a look at the position of the baby's head, the shape of the head. We could have a look at what we call body collars, how the baby's body is positioned. Are they skewed one way? Do they have a preference with their looking over one shoulder? We look at feeding issues, latching, sucking, tongue ties. We look at digestive issues, like you were saying, reflux, colic, constipation. We look at sleep issues, like, babies, all babies can have disturbed sleep, but sometimes they can be not getting, again, optimal sleep because they're still holding on to some of that tension, and we can help release that to potentially improve their sleep. We can't definitely say that we can help babies sleep better, but we definitely can give them the opportunity to. And again, developmental support, looking at muscles and joint tension. And the biggest one, which I think is emotional support, which gets a lot, it's not well known, but babies have emotions. They're from the moment that they have a little brain, a little heart, they feel, they know. So again, if they haven't had an optimal birthing experience, they may be longing to tell their story. And we call this emoting. We hold space for them to be able to cry, to be able to let go of whatever it is they may have unprocessed in their system, what we call trauma. I mean, even a normal vaginal delivery is traumatic. Being pushed out into the world and having all of these lights and people and sounds, this is all new experiences. And some children may struggle to adapt to the outside world. And again, just helping them to calm their nervous system can really set the tone for, a beautiful initiation into life, and, get them set up for living their best life, really. That's kind of what we try and do is just support them.
So for people who don't know about all the amazing things that you guys do, when is the optimum time to bring a baby to come and see an osteopath? Is it kind of the first week, or is it normally after a couple of weeks? Like, when would you suggest? Because I personally think that it should be part of every kind of fourth trimester experience that you take your baby to see an osteopath.
No, I agree. And I think the UK are pushing for that. I was talking to some patients, and they're saying that they're trying to bring this in, that every child born actually goes and sees an osteopath to have that support and be checked, because even babies who can seem quite relatively at ease could still be holding some tension. And so, we want to be able to give them that opportunity to just, like I said, basically just be the best version that they can be from day dot, and help them to support their growth and development as they move through the different ages and stages. But in terms of when we can bring them, I mean, from day one. I mean, I treated my babies when I delivered. I was treating them then and there on the bed, and the midwives would come in and say, well, what are you doing? And I would talk about what osteopathy was. And it was fascinating that I was able to educate them on what I offered and how it worked. And from obviously, it's up to mum, and mum might not feel up to getting out of the house. So again, it's really dependent on the family unit. When does mum feel like she wants to come? But anywhere from day one, because it is such a gentle, nurturing touch, babies can be ready from the moment that they're born to receive a session.
And I mean, Gilliam talks a lot about this as well. He'll say things like, "Oh, Rocco was really accepting of the treatment today," and he always also says, "Oh, he's done now. He's done." Can you tell me a little bit more about how that works? Because I always find that so fascinating.
So that's that sense of being able to feel with our fingers. So when we have a developed palpatory skills, we can hone into to the listening and really read what the body it's like the body talks to us. And what we can sense is how the body is receiving the space that we're holding. Like, are we finding that the body is unraveling easy? Do we notice that there is some resistance in the body, in the tissues? And that's probably what he means by he's received really well, is that he's surrendered. He's allowed himself to open up, to receive the work, and his nervous system has felt safe enough to be able to let go of what he needed to let go of. And in sense of he's done, again, you can often feel that the body's done the work. You start to feel this sense of grounding, where no longer are they there's this haphazard feeling in the system. You start to feel this fluid tide, this sense of them getting heavier in their bodies. They tend to open their arms, they splay a little more, and you can see it, like you said, you could see in his face, he just dropped into this state of relaxation. So that sense of I surrender, I'm here and I'm just breathing and just super chilled, it can be a good indication that he's done. I mean, look, it's not like that for every baby, unfortunately. Some babies can have a very emotive session. They can cry quite a lot because they've got a lot to say, they've got a lot to let go of. So some babies can get a little, what it looks like, distressed, but in actual fact, this is what we do, is we can decide, or we can sense, is this baby actually emoting, or are they getting a little bit overwhelmed because maybe so much is happening in their bodies that they need a bit of a break now. And if that's the case, we'll scoop them up. We sometimes then get mum to breastfeed, and we'll treat them while they're on the breast, or mum will just hold them up and I'll walk around the room and she'll be rocking and I'll be rocking with her, and we're still, we're still working together as a unit to try and bring this sense of ease to their system.
Wow, it's so fascinating. And I know that lots of patients come to see you either pre-tongue tie or post-tongue tie. Now, how do you bring relief to babies pre and post-tongue tie? What kind of support do you offer there?
Well, I mean, the tongue is an interesting structure. I mean, I'm not sure if you know, but the tongue actually is continuous with the deep frontline fascia of the body. So the tongue actually goes down and continues into the diaphragm, which is the muscle of respiration. And then it keeps going down that frontline fascia into the deep hip flexors and all the way down the front of the legs to the toes. So if you've got a tethered tongue up top, you can see profound effects throughout the whole system. So sometimes these babies might have a lot of tension around their throat. You might find that they've got really tight jaws. They're not able to latch well. They can't get their head back because the tightness at the front is locking the front aspect, so they can't get the extension to get a good latch. They could have really tight hips. Again, they might find that they're not feeding well, so they're swallowing a lot of air, and then you're seeing digestive issues. So our job is to obviously identify the root cause. So I've done extra training to be able to assess for a tongue tie. So that's one of the things I do in all sessions when I do my screening is I go in and I have a proper sweep. I look at how they suck on my finger. I do all these different tests looking at how well the tongue moves left to right, up and down, how well it undulates to milk the finger. So this enables me to see how well the tongue actually moves. And that gives me an idea of, well, is this a true tie or not? Because some ties can look like a tie but actually function beautifully, and there may be some issues, but it may actually not be due to the tie. It could be due to still some birth trauma. So our job is to identify what is root cause here. Is there a tongue tie issue? And we're still going to treat the body, because by releasing all that other compensation, we're going to really maximize exposure of this frenum, so that when I feel like their body's nice and relaxed, I can send them to someone like Dr. Delphine or Dr. Medhat, and they can get a proper visual of their tongue. And then if they need to do a frenectomy, a release, they really can get a really good release, so that hopefully we never have to do that again. And then after the release, obviously we then want them to come back in at about 4 or 5 days post, so we can finish off releasing what still remains, that compensation, maybe around the jaw, back of the head, still around under the into the throat area. So we do a final session after the frenectomy just to tie all the loose ends and really get the body open and fluid.
Wow, so interesting. So we had a tongue tie, and I really thought it would help with our reflux issues, and it definitely has, for sure. But he still really struggles with his latch. And even he's my first child who's ever taken a dummy, ever. And I mean, he's obsessed with the dummy because it really soothes his reflux, but he can't hold on to it, so it falls out all the time. As you can imagine, it's really fun at 3 a.m. in the morning.
Oh, I can imagine.
When I'm like putting it back in. Oh, God.
You have to have 10 around the bed. So if he loses that one, you just grab the next one, whatever's closest.
Yeah, exactly. But it's kind of got to that stage now, because I've never had a child who's had a dummy. I don't know whether it's an age thing, or maybe it's he's just still struggling with something in his mouth and he's just not got that latch. But it's hopefully something that when I come and see you, you'll be able to tell me about. Yeah,
we can check. We can still check. Maybe there's something kind of happening at the back of the neck. Like we still want to look at what's happening in the vagus nerve, the glossopharyngeal, the hypoglossal, all these nerves that come from the brainstem that come forward to innervate the mouth. Sometimes there may still be a little bit of tension there that's inhibiting that nerve to allow the tongue to fully function. And there are things we can give. We can give you some exercises to work on where we get you to literally put your finger in, get him to suck. And as he lifts the tongue, you can push your finger down. So it's like doing resistance training, because the tongue is a muscle and you can train it to function better.
Wow.
Yeah, so there are things we can help, yeah.
Well, that's amazing. I'm very excited. And then let's talk reflux, colic, digestive issues. Now, this has kind of always been the reason why I turned to osteopathy. And even now, you know, I think with my first 2 children, we only ever really did a couple of sessions and then they were so much better. Whereas Rocco, He's 15 weeks now, and we have to come every 2 weeks. And when we get to that 2-week mark, I can feel everything starts, like all the kind of wheels start to come off, as it were. And you can see that he needs it. He needs to go and have that release.
Yeah.
How can you help children with colic, digestive issues and reflux? So what is it that you're working on that relieves these issues?
Again, like we're looking at root cause. We're trying to identify where in the body may there be some residual tension. So even in colic and reflux, we're going to have a look at the pelvis. You know, what's happening? Is there tension down there? Are they able to move their hips well enough so that we can, you know, that they can encourage these gas bubbles and their poop to move down through the intestines properly? We want to check the abdomen. How's the torso moving? How's the actual organs themselves moving? Like, because there may be, for example, if the cord was wrapped around his body, there may be still some imprint of that cord limiting the intestines from moving optimally, and that could be why there may be more trapped gas, for example. So it's not only about we want to find the root cause, but we're also trying to help them alleviate symptoms. So we've got to look broadly. It's not just about, okay, let's just look at the gut. We have to go all the way back to, well, what's happening at the neck? How is he feeding? Like, if he is not able to get a really nice extension in his neck because he's got some tension at the back of the head, what might be happening is that he's swallowing air, and then the air is causing distension, and then he's bloated and he's fussy and he can't relax, and it just is this ongoing problem because kind of he's fighting something that he can't release on his own. So again, it's just our job to find where is that problem. The common one we do find is around the back of the head, because obviously as they come either through the birth canal, where you get the overlap of the cranium, there's a lot of shift that's happening up there. But even if they're a C-section baby, the lack of movement that the cranium has can also be problematic, because we're not getting what we call this ignition, where we get these fluids moving, we get the neck to move as it comes through the birth canal. All these things really help set up the reflexes. It helps set up the body into being more dynamic, and all these things are important in helping the nervous system to feel more optimal. So again, by working around the head, we can affect the vagus nerve, which helps with digestion. It is really the thing that governs our ability to digest well. I mean, the gut is like our second brain, so we want to treat the nervous system, but we also then want to really optimize how the gut itself is moving. So it's a head-to-toe approach. We want to scan and check right up and treat everything we find where we see there is an issue.
And with these kind of gassy, refluxy babies, do you often suggest that this is like ongoing treatment, or is it normally something that you see patients once, maybe twice, and then they're kind of much better?
It varies, really. I mean, some babies will have one session and the parents will come back and say, I don't know what you did, but like he's pooping so well now, and the feeding's improved, and so therefore he's burping better, and it's heaven. And then you get some that it is ongoing, and you often find that might be related right back to conception. There may have been a lot of stress around conception. There may have been a lot of stress that mum was having during her pregnancy. It may have been a more traumatic birth than the others, and so this baby, again, the nervous system might be a little bit more dysregulated, or even personalities. Look, some kids that are much more sensitive are more volatile in terms of their presentation. These kids often will show a lot of their emotions in their body. So we by helping them feel safe and regulating the nervous system, we're really going to optimize all functions, from how they feel to how they think to how their body moves and how they digest, how they sleep. All of these things can be influenced by working on them.
So interesting. And I mean, do you see more or less issues with maybe premature babies or really big babies, or is it across the scale?
I definitely think the babies that are born more robust tend to have, from my own personal experience, tend to have a more, their digestion is actually easier. I find they've got much less issues But again, it depends. If they've got a tongue tie and they're a big baby, they still could have issues. But if it's generally there's no other findings and they've had a relatively easy birth, then I do find that the bigger babies tend to just be much easier, where the premature ones, obviously, again, being premature is traumatic, right? They're not fully cooked. They're not fully at like optimal gestation age for delivery. So why they're premature, again, we have to look at that. Is it because that maybe they didn't have enough amniotic fluid, or there was there was some reason in terms of maybe mum had blood pressure issues and baby had to come out early, and this baby still might be feeling the effects of that stress in their system, and so therefore they're already going to be suboptimal in terms of their digestion, also because they've got a more immature gut to start with. That also is going to put them a little bit on the back step, but they catch up very quickly. Premature babies are amazing. Like by one, it's pretty much they're on par, unless they're severely premature. Most babies that are only slightly premature will catch up very quickly. So we see them on the developmental milestones. After 12 months, they're great.
Yeah. And what about flatheads?
Oh, nice.
Flathead syndrome, because it's quite common.
Very.
I've known a lot of babies recently who have suffered from flathead syndrome. How can you help babies who have flathead syndrome?
So basically, flathead can happen in two ways. It can start in utero, depending on how baby's sitting. So if baby is a bit more transverse or stuck up against mum's ribs, or they're in the optimal position, but they're kind of wedged in there for some time, they can start to already have some molding strains to the cranium. These ones are much harder to treat because they often are quite ingrained. So they can then be born, and we were already seeing quite a distorted head shape. Then you get some that might be born with a torticollis, so they've got a wry neck and they're stuck laying on that right side, and very quickly they start to acquire a flat head purely because they can't move in any direction. So it really, in terms of both do well with treatment, but I often find that the ones that happen in utero need treatment over a much longer period, because we really have to support the development period. We have to work on fine-tuning the cranial motion and really optimizing how those fluids move at the cranium. We have to release the neck. We have to really improve the entire skeletal system so that we can also relax the nervous system. We can release the membrane tension, which lays over the brain and under the cranium, which has an influence on the shape, so that we're really encouraging these bones to move more harmoniously. And then obviously as the brain grows, the cranium will start to remold. So as an osteopath, we can't pull a bone out. Like, that's a complete misnomer where people think, oh, you can reshape my baby's head in one session. It doesn't work like that. What it is restoring the balance so that as they start to grow, we see this natural remolding happen. So again, it's really about identifying where do we feel there's tension and restriction, working with them to resolve that, opening everything up, getting it all fluid and dynamic, and then seeing these changes evolve over some time. Again, it may be a short period, it may be a couple of sessions for a child who's got a very mild plagio, and it can be, a year and beyond for these ones that happen in womb. And it's not to say they need a lot of treatment, but we usually start quite intensively, and then we give them a period of time for them to grow, and then we'll go in again and we'll fine-tune some more dysfunction that we've found, and again we give them more time. So we're supporting them and spreading out the treatment, but the cranium continues to grow, and we're looking at, in terms of how the sutures fuse, they all fuse at different periods, but generally we have the best opportunity for remolding in that first 6 months of age. After that, we start to see a decline because of the fusions that are happening. We find it harder, but not to say that we can't beyond 12 months. It's just a lot more difficult. So if I'm seeing a baby come to me at 11 months, the likelihood is that I may be able to get a lot of things moving, but we might need to bring in a helmet to support that change, because it's just too far gone.
Yeah, that was my next question. At what point is it too late? But
Yeah.
there's still stuff that you can do. It's just harder the older they get.
For sure, and the key thing here is, like, you don't just want to get a helmet, because the helmet is looking at it cosmetically. Yes, it's addressing some of the base of the skull and how things move, but we also want to look at how that integrates with the whole body. Because if they've got a twist at their pelvis and the base of the skull is mirroring that, and you go and fix the cranium with a helmet and you don't fix the pelvis, these kids are going to have a beautiful head, but they're going to still, their midline's going to be off. So you might find that they might have issues with achieving their milestones, or they might have really awkward gaits because their midline's off, and so they're running one way and they've got this arm that swings out and this leg that does something else because their body's not kind of had that opportunity to also have work to balance the entire system and integrate it all together.
Honestly, it's so fascinating. I feel like I'm learning so much today. I want to end with sleep. We touched upon sleep earlier, and you mentioned briefly that you help babies with sleep. Now, can you give me an example of a parent who might have come to you with a child that's not sleeping, and what might the issue have been that was stopping them from sleeping properly?
Digestion is a big one.
Okay.
So, they get that, they sleep maybe well at the beginning of the night, and then they go for that kind of 2 a.m. feed. And then after that, it's like, oh my God, my baby just had wind, their legs are up, they're flapping around.
Kicking.
Yeah, they can't settle. And again, this might be purely because they're uneasy. They can't get their wind out, whether they have tension at the pelvis, they have tension in the hips, they have tension at the head. So just by releasing that can be enough that they can get those winds out. Because obviously when they don't, that first window when they sleep, they don't feed for some time. So the gut gets a rest. But then as soon as they have an intake of food, the digestion starts to kick in. I mean, it's quite normal that you get your digestive enzymes starting and, the intestines are moving. And obviously the byproduct of all of that is they're going to either burp or they're going to have farts. And because babies can't actually create what we call a valsalva, they can't squeeze their abdomen to push out their wind, they wriggle. That's the only way they can get it out. So wriggling is normal, but if they're distressed and they actually can't wriggle well, then they're not going to get it out and it's going to linger, which makes them more and more distressed, which is why then they can't sleep. So by just balancing these tensions, we give them ample opportunity to then wriggle these things out, and they do their fart, their poop, and off they go. They're back to sleep and they're happy as Larry. So, that's a fine example. I mean, I have those a lot of the time. The other one is the tongue tie. Again, they may have not been able to feed well. There's lots of air, and so they're either refluxing or they've got abdominal distension and they've just really bloated. And by helping to identify the tie and then sending them off, having that frenectomy done and then coming back and fine-tuning all of that leftover tension, they're then beautiful feeders. They're not swallowing air, they're no longer distended, and they sleep much better.
Yeah, exactly. It's all linked to sleep, because if they're obviously got a tongue tie and they're not feeding properly, they're probably also not getting enough.
That can happen too, definitely.
And then they're just hungry all the time.
Yeah, you see that very often as well.
Yeah, I bet. Before we move on to tips and products, is there any myths that you'd like to debunk around paediatric osteopathy?
Definitely. The first, what I would say... Sorry, can we stop? My doorbell's ringing.
Yeah, go for it.
Can you give me 1 minute? Sorry.
Yeah.
Sorry.
Don't worry.
On Amazon, all hours of the night.
Oh, Yes, so debunking myths.
Okay. Debunking myths. Well, there's quite a few, to be honest, but let's start. Okay. So one of them about osteopathy in general is that osteopathy is too harsh for babies. So sadly, there are some pediatricians out there who, often will not recommend osteopathy because they think that we're going to be too aggressive and apply the same kind of forces we would on a mature adult spine. So that's one thing that, when you're working pediatrically, you're using a much refined touch, very light. You've seen it for yourself. It's very gentle and nurturing. And so it's only purely there to support them. We're not going to do anything aggressive because they've got such an immature spine, an immature nervous system. We have to really be considerate of that and find those gentler, indirect techniques that can still achieve the same results, but with a much lighter touch. So that's one of the biggest ones that I do find. Like we talked about again, osteopathy can cure all sleep issues, which is a definite no, because babies aren't meant to sleep through the night. And so we can make them feel more comfortable so that we can open up the opportunity for a baby to really sleep better. But in terms of curing all sleep issues, then that's a definite no. So definitely we have a role in sleep, but it's not going to be the answer for everyone. Like some people will come in and will say, oh, my baby needs to sleep. And I'm like, describe the sleep. Well, they wake up every 2 hours and they feed. And I said, and how are they after? They're fine. I just don't want them to wake up every 2 hours. I'm like, but that's what babies do. They have a very small stomach and they need to eat regularly. And again, it's just educating, especially some new parents who may not know that. I mean, these are simple things that we don't always get taught, but just informing them and educating them on why this is normal, we then can, we can help them understand that better.
Yeah, so true.
Another one is that osteopaths aren't qualified to treat babies. Now, some osteopaths aren't because they haven't gone and done more in-depth study in pediatrics. So if you want to take your child to see a pediatric osteopath, just make sure they're trained in pediatrics. That's it, because there are subdivisions, and when you're ringing up to ask about what does that pediatrician or what does the osteopath do, you just want to know that you're going to the right person for your needs at that moment. So if it's your baby, you want a pediatric. If you've got, maybe as an adult and you've got digestive issues, you want to see a visceral osteopath. If it's more stress response and you're feeling really unsafe and you've got trauma, you can go and see Cranial or craniosacral therapist. So, it's just knowing what it is you want and looking for the right qualified osteopath. The other big one is that osteopathic has no scientific basis. We get that one a lot as well, right? So again, osteopaths, we don't have the finances to do these randomized double-blind control studies. There are a few out there, and there definitely needs to be more. So we're really trying in the industry to get more research done, but there are plenty of case studies. There are plenty of really simple, really effective studies out there that show a lot about what we do in both the adult population and the pediatric population. So sadly, again, a lot of mainstream medical practitioners will say, osteopathy doesn't have any scientific backing. And I'm like, have you actually researched that? Because there is plenty. I mean, you only have to Google osteopathy scientific research, and it will start. It's at our fingertips now. We can do our own research if we really feel the need to. So there are plenty of studies out there.
Thank you for sharing all that. And Lauren, if you were to leave us with one tip and one product recommendation for the day, what would they be?
My biggest tip would be let your baby move. We see so many babies come in wrapped up like little sausage rolls, and they need to move. I mean, they need to release everything that they carry from their birth. They need to integrate their reflexes for beautiful growth and development, for milestone achievement. They need to be able to move to really just start to work on knowing their body in space, proprioceptive. They need to be able to learn this hand-eye coordination for bringing food to their mouth, for moving through their milestones is the biggest one. So let your baby move. Lots of tummy time. Let them wriggle around. And again, even at night, if your baby isn't one that is overly sensitive and has a huge morrow, even letting babies sleep without a sleep, like a sleep sack that really kind of locks them in, that would be my recommendation, is look for one that at least allows the arms to still flail, but maybe has an end boundary. And that could be where my product actually lies. I would definitely in that instance look at something like the Love to Dream swaddles, because not only do they give them a little bit of security, but they're stretchy, they allow the hands to be up, they allow them to muzzle on their hands, but it gives them that sense of a boundary, which is like what they would experience in utero. They have the amniotic fluid, but then they've got the walls of the uterus, so they can move around, but they still feel safe. And that's what I love about the Love to Dream, is you can use that for those initial first 2 months or so, and then you can actually get the ones that you zip off the wings, and it becomes a beautiful sleep sack, which is again really safe. We don't want blankets in the cot. We want something to keep them warm, but it's secure, and then it lets them to move their arms so they start to roll, and it supports them.
Love this. Thank you, Lauren. And Lauren, for anyone who wants to reach out, say hi, ask you questions, come and find you, where can they find you?
Well, I'm currently working at my second family, which is at Heel Hub Rehabilitation Centre, which is next to Kite Beach. My email address is Lauren, LAUREN, @heal.ae.
Perfect. I'm going to link all of this in the show notes. Lauren, you've been wonderful. Honestly, I feel like I've had such an educational evening, and I'm so excited about coming to see you.
I look forward to seeing you.
I can't wait to hear what you've got to say about small baby Rocco. But until then, have a wonderful evening. Enjoy the peace and quiet whilst you can.
I will. Thank you very much.
And thank you again for being such a wonderful guest.
My pleasure. Thank you for having me. Have a great evening. Bye.
Thanks. Wait there. Sorry, 2 seconds. I'm just going to press stop and everything.